Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books. Our mission here at Health Authority TV is to bring together a community of health business experts and find out what's happening in their area of health and also look to future possibilities. This week, we are joined by Dave Mastovich, author of No Bullshit Marketing. Welcome, Dave.
Hey, Devin, thanks for having me.
Yeah, nice to see you. So, Dave, if you could tell us, who do you serve as a health authority?
Thank you. Sure. MASSolutions serves healthcare leaders, providers, and organizations that want to grow. And that might sound, wow, everyone wants to grow. If you really want to grow around increasing referrals, growth in patient acquisition, and solving the talent crisis, you need someone like MASSolutions to drive that growth for you through strategic marketing, storytelling, business to employee marketing, and campaigns around all of that. And that's what we do. So we work with healthcare systems, Medicare HMO plans, hospitals, physician groups, senior living, hospice, home care, physical therapy, other specialty healthcare businesses. And it's all about if they have a growth mindset and they're looking to grow patients through referrals and through the general public, but also looking to find and keep the talent to drive that growth.
Nice. I love that. I think having a growth mindset is very important.
Sure.
Well, then that leads to the next one. What services do you provide in that area?
It comes down to this. In my opinion, the no bullshit marketing guy, my opinion is healthcare marketing is broken. So most people in healthcare treat it as an expense instead of an investment. Now, those that have treated it as an investment have grown, like some of the companies I've had the opportunity and the fortune to be a part of that grew from like one grew from under a billion to 10 billion in a short time because they saw marketing as an investment. That's not normally the case. It's often seen as an expense, especially by companies that are more in that 20 million annual revenue to 100 million annual revenue or even smaller. And what we try to do is help them understand that that's a broken model. Looking at marketing as an expense is broken. We want to flip that mindset and make marketing work for them. We want to make it measurable because that's their biggest frustration. We want to make it strategic, which they may not realize that it's not as strategic as it needs to be. And we want to make it all growth focused. So what that means specifically, what MASSolutions does is we build your growth marketing strategy and a plan, and we build it around the behavioral science driving the creative art. We want to do some voice of the customer research, talking to referral sources, talking to patients, talking to families, talking to employees, talking to leaders. So we want to get some of that voice of the customer insights. But we also want to look at your patient data. We want to understand where they're coming from, who's referring them, what has the growth been or the lack thereof. So we want to understand all that. But we also want to understand your employee base. We understand where your employee gaps are. What are the talent challenges? And so that's what we call business to everyone because it's all about the 6 target markets that matter. Many people think of their target market as patients. Maybe they think of current patients and prospective patients. That's 2 of them. But the other 4 target markets are current referral sources and prospective referral sources, current employees, and prospective employees. And we want marketing to be fixed and to be valuable, fix the broken system and be valuable to all those healthcare companies by focusing on those 6 target markets that matter and making it measurable, strategic, and growth focused. Now,
Well,
some of that I probably didn't give enough specifics, but there's that research piece, the insights piece, which is going out and talking to people, gathering information with our research team. But there's also the storytelling piece. It's letting the behavioral science drive the creative art to come up with your big idea, your tagline, and the storytelling pillars under it. Then it's building the campaigns to drive the growth. And the campaigns within referral source marketing are a certain type of campaign. The campaigns for patient acquisition is a type of campaign. The campaigns for employee acquisition and retention are a different type of campaigns. All the stuff involved in that, whether it's email drips, video, SEO, and beyond, those are the elements that we do from the execution standpoint. So it's not just looking at those six target markets that matter. That's the first thing nobody does, I don't think. We're starting to see more of it now that the book hit #1 bestseller. But now you got the strategy part, the insights part, but then the execution part is also done, and that's done through various types of team members that we have here at MASSolutions.
Yeah, absolutely. I mean, as coming from the book world, we are big fans of storytelling as well and how powerful it can be. I think especially in the health space, because those stories really can touch us on such a human level and really connect us
Sure.
as people and community. So that's wonderful to hear. So
Yes.
our last question for all of our guests is, based on your experience as a health business expert, how do you feel like we can redesign America's healthcare system?
I think it comes down to those six target markets that matter and what are we living in today in the world? We were an industrial economy through the 80s and 90s. And then we became a service economy in the 90s and 2000s. And then the last 10, 15 years, we became an experience economy. But yet in healthcare, we don't focus enough on the experience of all six of those right fit target markets, all six of them. And that's the problem. When you fix that, and when the mindset shifts and we communicate differently to all six of those right fit target markets about maximizing their experience. So we hear from them. What do they think their experience should be? What is their experience today? What's frustrating to them? What's great to them? And then tell that story again and again so that we can match up that referral source specialist physician with another specialist that is the right fit for that patient and their family. When we can match up senior living in the right way so it's not as scary or as scary of a thing. So it's about looking at the six right fit target markets and their experience, focusing all on that experience and doing that by learning what they're thinking, feeling, and what their wants and needs are, delivering that, tweaking your product to deliver what's needed, and then telling them about it again and again and again. So that's what growth marketing is all about, is driving patient growth, referral source growth, and employee growth by understanding those six target markets that matter, by hearing from them, studying them, learning from them, so we can give them the best experience possible. When we do that, we'll solve the revenue problem in healthcare and we'll solve the patient outcomes problem in healthcare. That's what it is. Redesign that healthcare system that prioritizes the experience, the customer experience of all six of those right fit target markets.
Great. Well, thank you so much for sharing that idea. And for our listeners, this is a conversation that we want to grow and build on. So we would love to hear your thoughts on ways we can redesign America's healthcare system. And thank you so much for joining us, Dave. And if you want to learn more about those six target markets, please check out Dave's new book, No Bullshit Marketing. We'll leave a link in the show notes for you. And until next time, may you be healthy, wealthy, and wise.